You're pregnant and you're thinking about a cesarean section because you think it's going to help protect your pelvic floor and prevent you from any sort of pelvic floor issues such as urine leakage, pelvic organ prolapse, all the things all your friends who just had a vaginal delivery are complaining about. If you think a C-section is going to be 100% protective of your pelvic floor, think again. Hi everyone, I'm Dr. Nabila Noor, a board-certified and fellowship-trained urogynecologist and a pelvic reconstructive surgeon, and I get this question all the time, whether a C-section is better than a vaginal delivery when it comes to protecting your pelvic floor. Here's the truth. While a cesarean section can bypass things like vaginal lacerations or an episiotomy, it is not 100% protective, and women with a C-section can also have pelvic floor issues. So in today's video, I'm going to give you 3 important facts about what is really happening in your body when you're pregnant, and can a C-section actually be protective? And stay tuned for number 3 because that's the most important and truly the most shocking for most people. So let's get started. Pregnancy fact number 1. Pregnancy changes your pelvic floor long before your baby is actually born. This may sound a little silly, but for 9 months, as you're carrying the baby in your uterus, the uterus grows in size, the volume of fluid in your body increases, the placenta and all that amniotic fluid increases the weight to your pelvic floor, and all this combined puts a lot of pressure on your pelvic floor muscles. So all that weight increases the pressure on your pelvic floor as well as stretches those muscles and ligaments way before the actual delivery process has even started. So some damage to your pelvic floor has started just by virtue of you being pregnant. Pregnancy fact number 2. Hormonal changes in your pregnancy can affect your pelvic floor muscles. Now, during pregnancy, our body releases hormones such as relaxin and progesterone, which can make your ligaments soft and stretchy. That's nature's way of helping your body prepare for the process of labor and delivery. But remember, as those ligaments stretch and become loose, it also affects the stability of your pelvic floor and makes your pelvic support less stable. This is why even women who have had cesarean section can notice pelvic floor issues such as pelvic organ prolapse, urinary leakage, and bowel concerns. And finally, pregnancy fact number 3. A cesarean section is a major abdominal surgery. And what that means is you're going to get cuts in multiple layers of your abdominal walls, starting from the skin to the underlying fascia, to the muscles, to the peritoneum, and all these incisions can make those abdominal wall weak. Because of this abdominal incision, your core stability can be affected, which in turn can affect the strength and stability of your pelvic floor muscles, especially as you start getting back to your exercises and trying to strengthen your pelvic floor muscles and your core. And also for those of you who are thinking of having a large family, every time there's a cut on your uterus, that puts you at a higher risk for placenta-related complications in your future pregnancy. Things like placenta previa, placenta increta. These are all serious complications of pregnancy that can lead to significant bleeding for moms, and I've seen many women end up with a hysterectomy as a result of these complications. So what's better, cesarean section or vaginal delivery? The truth is, whether you choose a cesarean section or a vaginal delivery, pregnancy itself can cause trauma to the pelvic floor muscles, so it's very, very important post-pregnancy or in the postpartum period, with the right guidance, women focus on improving their pelvic floor strength so that no matter what their mode of delivery was, they can eventually build a strong pelvic floor again. Many of my patients and even friends and family ask me if I would recommend a cesarean section, and honestly, my answer is the best mode of delivery for your baby is the safest mode of delivery. For some women, it can be a vaginal delivery, while for others, it can be a cesarean section. It's a very individualized decision and oftentimes based on how your labor is progressing and what your particular health condition and past medical history is. So I would recommend, if you are somebody who has concerns about how you want to deliver your baby, have a candid conversation with your OBGYN, and if needed, get a referral to see a urogynecologist so we can talk to you about the specifics of your particular condition. If you found this video helpful, then don't forget to hit the subscribe button and also share this video with a friend, especially somebody who's pregnant or maybe a new mom who's concerned about how to get back to improving their pelvic floor. You can also follow me on my Instagram and TikTok at Dr. Nabila Noor. So I'll be back again next week with another engaging video about your pelvic floor. Till then, stay well, stay healthy, and don't forget to take care of your pelvic health. Bye!